Prisms are actually they're prescribed in the lenses. Oftentimes they can be used during treatment. They're actually used to shift light in the eyes, and then what that does is it changes the perception of space for that individual. Prisms were commonly looked at as correcting an imbalance, and in this particular case, we often use yolk prism. For post-trauma vision syndrome, the most common approach is using small amounts of base-in prism. Oftentimes it could be in the order of about a quarter to as much as one or more prism diopters of base-in.
And for somebody who has post-traumatic vision syndrome, is that something that's going to show up right away after an injury? Is it there's a delay? Is it something that lasts for a long time, or is it something that's short, like lasting?
Most oftentimes we see it immediately, which is why when I'm at the rehab facilities, we like to see the patients in an inpatient setting so we can address the condition very quickly. It's not unusual that we see this condition persist for years post-injury. In some cases, I've seen some patients here that have been 3 or 4 years out from an injury, but they present with persistent symptoms.
Hmm.
And so after my clinical examination, we find that it still exists. I demonstrate that to the patient, or I show the patients the different findings, demonstrate the changes that can be affected using different lenses and prisms, or discuss working with the other rehab professionals if they're still in comprehensive rehabilitation therapies elsewhere. And so it just does not go away. And patients are usually grateful to find out that there are things that still exist that and the fact that something could be done about it.
And would you say that most people are going to an optometrist and then they're finding out they have, after having an injury, they find out all the information from that optometrist, or is this really something more specialized that your normal optometrist might not be able to direct that? Yeah, how does that work normally?
Well, that's kind of the goal that we have at the at different levels of different organizations as we try to educate our colleagues. That's also being done at the colleges of optometry. They do have courses of neuro-optometric rehabilitation. There's different organizations, most notably the College of Optometrists and Vision Development, the Neuro-Optometric Rehabilitation Association, and the Optometric Extension Program Foundation, where collectively we have a number of optometrists who are familiar with working with traumatic brain injury patients. It is our job to try to continue to educate our colleagues so that appropriate referral is made.
So you would say that in those cases, the goal is to refer to somebody who specializes in that area of these specialized prisms, specialized optics, and other treatments for post-traumatic.
Absolutely. Yes.
And is there like an age range where this is more common, post-traumatic vision syndrome? Is it something that's like younger kids or older people, or it's really kind of a broad spectrum?
It spans the entire lifetime. Patients who are very young, who've suffered an injury, they have a fall, as I mentioned. Sometimes kids experience injuries when they're also, passengers in a car. And it goes all the way up to the seniors who suffer strokes.